16 signs of thyroid disorders you should not ignore. Did you know that over 20 million people in the U.S. are suffering from thyroid disorders? And ladies are 8 times more likely to be affected. The thyroid gland is very vital because it produces hormones that regulate our metabolism, growth, and development. But when things go awry with our thyroid, it can lead to a whole host of symptoms, from feeling tired to heart palpitations. In this video, we'll explore the symptoms of both hypothyroidism and hyperthyroidism, so you can be aware of what to look out for and take charge of your health. First, we have a very weird symptom. Number 1, feeling warm. Hyperthyroidism causes your metabolism to rev up, which can make you feel like you're burning up, even in cool environments. In fact, research has shown that about 90% of people with hyperthyroidism may experience symptoms such as increased sweating, heat intolerance, and feeling warm or hot even in cool temperatures. Researchers in a publication in the Journal of Clinical Endocrinology and Metabolism found that patients with hyperthyroidism had a higher skin temperature than those without the condition. So if you find yourself sweating like crazy and feeling like you're in a sauna all the time, it might be worth checking in with your doctor to see if your thyroid is the culprit. Did you know that 34% of people with low thyroid levels experience muscle cramps? Number 2 is loss of strength. When your thyroid hormones go haywire, your body's metabolic switch flips towards catabolism, breaking down muscles for energy. This can leave you feeling weak and achy. However, there is good news. Treatments to replace low levels of thyroid hormone with a synthetic thyroid hormone called levothyroxine have been shown to improve muscle strength and decrease aches and pains. While some weaknesses and aches after strenuous activity are normal, new or increasing muscle weakness or even pain should be discussed with a physician. When your thyroid gland is overactive and producing too much hormone, it can cause your metabolism to rev up to high gear, leading to rapid emaciation. Number 3 is weight loss. According to one study, up to 90% of people with hyperthyroidism experience weight loss. This weight loss can be accompanied by other unpleasant symptoms such as fatigue, nervousness, and increased heart rate. So if you're noticing weight loss without any changes to your diet or exercise routine, and you're experiencing other symptoms, see your doctor to rule out any thyroid issues. Another sign you might be noticing is huffing and puffing during your daily workout. This is because your thyroid gland might be working overtime. Number 4 is shortness of breath during exercise. Exercise is supposed to make you feel better, not worse. However, when you have an overactive thyroid, your body is revved up like a sports car, burning through fuel faster than a race car at the Indy 500. This increased metabolic rate can lead to shortness of breath during physical activity, as your body is working extra hard to keep up with the demands of exercise. Research has shown that shortness of breath during exercise is a common symptom of hyperthyroidism. A research paper published in the Journal of Clinical Endocrinology and Metabolism found that hyperthyroid patients were more likely to experience shortness of breath during exercise than those with normal thyroid function. See a doctor if you're experiencing any unusual symptoms during exercise, especially if you suspect they might be related to your thyroid. Feeling like your heart is racing a marathon, even when you're just chilling on the couch? Number 5 is increased heart rate. Your thyroid gland, which sits at the base of your neck like a tiny butterfly, regulates your metabolism and energy levels. But when it goes into overdrive and produces too much thyroid hormone, it can make your heart beat faster than a cheetah chasing its prey. About 90% of people with hyperthyroidism experience an increased heart rate, as stated by the Journal of Clinical Endocrinology and Metabolism. Studies also show that up to 90% of people with hyperthyroidism experience heart-related symptoms, including heart palpitations, rapid heart rate, and even heart failure in severe cases. Research has also shown that hyperthyroidism can increase heart rate by up to 20 to 30 beats per minute, which is a lot considering that the normal range is between 60 and 100 beats per minute. In addition, hyperthyroidism can also lead to other cardiovascular symptoms, such as palpitations, high blood pressure, and arrhythmias. Addressing these symptoms promptly is essential, as they can increase the risk of cardiovascular disease in the long term. So if you're feeling like your heart is working overtime, it might be worth checking in with your doctor to see if your thyroid is fine. But in the meantime, skip the coffee and energy drinks. Your heart will thank you. Research shows that approximately 40% of women with low thyroid hormone experience increased menstrual irregularity or heavy bleeding, compared to only 26% of women with normal thyroid levels. Number 6 is menstrual problems. The reason behind this connection is that thyroid hormone interacts with hormones that control the menstrual cycle. Hence, abnormal levels of it can disrupt their signals. Additionally, thyroid hormone has a direct impact on the ovaries and uterus. However, it's important to note that heavy or irregular periods can also result from other problems aside from hypothyroidism. Therefore, if you experience such symptoms, it's advisable to seek advice from a gynecologist before worrying about your thyroid. Irregularities with your bowel are another potential symptom of hyperthyroidism, and it's not exactly a fun one. Number 7 is diarrhea. When your thyroid gland is in overdrive, your digestive system can be affected too. Research has shown that hyperthyroidism can cause an increase in the frequency and volume of bowel movements, as well as changes in the consistency of stool. Research has shown that about 10% to 20% of people with hyperthyroidism experience diarrhea as a symptom. If you have been racing to the bathroom more than usual, your thyroid might need some attention. Feeling anxious, nervous, or restless are common psychological complaints associated with hyperthyroidism. Number 8 is psychological complaints like fear and irritability. An excess of thyroid hormone can lead to overstimulation of the nervous system, causing feelings of anxiety, nervousness, and restlessness. This can also lead to difficulty concentrating and sleeping, and mood swings. In fact, one study found that over 80% of hyperthyroid patients reported experiencing psychological complaints such as anxiety, irritability, and nervousness. These symptoms can affect a person's quality of life. So, you need to seek medical attention if you're experiencing them. So, if you feel more anxious or irritable than usual, it may be worth considering if hyperthyroidism could be the cause. Don't hesitate to talk to your doctor and get the proper diagnosis and treatment. Your mental health, like your physical health, is important. Alright, enough about hyperthyroidism. Let's talk about the symptoms of hypothyroidism. Have you been swiping the snooze button on your alarm in recent times? Feeling like you could fall asleep at your desk? Could be hypothyroidism. Number 9, fatigue. Low thyroid hormone levels can slow your body's metabolism, which means you don't have as much energy as you usually would. Fatigue is the most common complaint of people with hypothyroidism. Research has shown that fatigue affects approximately 80% of people with hypothyroidism, and it is often one of the first symptoms to appear. Fatigue can be so severe that it can end in depression. Visit your doctor if you are experiencing persistent fatigue, as it could indicate an underlying hypothyroidism. Did you know that some of the heart problems associated with hypothyroidism are caused by an increase in cholesterol levels? Number 10, heart problems. When thyroid hormones are low, your liver produces more cholesterol, and your body has a more challenging time breaking it down. This can lead to a buildup of cholesterol in your arteries, increasing blood pressure and, by extension, your risk of heart disease and stroke. Low thyroid hormone levels can cause a range of issues with the cardiovascular system, including a higher risk of heart issues and elevated levels of cholesterol and triglycerides. Research has shown that people with hypothyroidism are at risk of heart disease, more than those with normal thyroid function. In addition, hypothyroidism can cause the heart to beat more slowly and forcefully. If you have hypothyroidism and experience symptoms like chest pain, irregular heartbeat, or difficulty breathing, your doctor can recommend medications or other treatments to help manage your symptoms. Or you can just watch one of our videos. Are you always grabbing an extra blanket or cranking up the heat? It might not just be a preference for coziness. It could be a sign of hypothyroidism. Number 11, feeling cold. When your thyroid hormones are low, your body's ability to generate heat decreases, leaving you feeling colder than those around you. How? Heat is a byproduct of burning calories. Even when sitting, you are burning a small amount of calories. However, in hypothyroidism, your basal metabolic rate decreases, reducing the heat you generate. Low thyroid hormone levels cause you to feel colder than others around you. About 40% of low thyroid individuals feel more sensitive to cold than usual. If you've always wanted a room warmer than the people around you, this may be how you are built. But if you notice yourself feeling colder than usual, it could be hypothyroidism. Feeling like you're packing on the pounds for no reason? It could be your thyroid's fault. Number 12 is an increase in weight. Hypothyroidism can put your metabolism on snooze mode, making you burn fewer calories at rest. So even if you're not a couch potato, you may gain weight unexpectedly. Have you been eating right and hitting the gym but still feeling like your clothes are shrinking? It could be your thyroid playing tricks on you. When thyroid levels drop, your metabolism slows down, causing your body to hold on to those calories like precious gems. Studies have shown that people with hypothyroidism can pack up to 30 pounds in just 1 year. If the scale is tipping in the wrong direction and you can't explain why, it might be time to talk to your doctor and see if your thyroid is to blame. Your luscious locks are your crowning glory, but losing them can be a real blow to your confidence. Unfortunately, hypothyroidism can make your hair fall out faster than autumn leaves in a storm. Number 13, hair loss. Hair follicles need thyroid hormones to keep them healthy and happy. These little guys hibernate when your thyroid levels drop, leading to hair loss. Don't worry though, once your thyroid issues are sorted, your hair will grow back. If you're shedding more strands than usual and your hair's looking pretty patchy, it's time to consider hypothyroidism as a possible cause. Studies have shown that around 25 to 30% of people who see a hair loss specialist have low thyroid hormone levels. So if you're feeling a little thin on top, don't despair. Talk to your doctor and get your thyroid levels checked. You'll soon be back to rocking that luscious mane like a superstar. When your thyroid hormone levels are low, it's not just your physical health that can be affected, but also your mental health. Number 14, depressed feelings. Hypothyroidism is linked to depression, with 64% of women and 57% of men reporting feelings of depression. The reasons for this link between hypothyroidism and depression are still unclear, but it could be a mental alert of an overall decrease in health and energy. When you don't have enough thyroid hormone, your metabolism slows down, and your body doesn't produce enough energy to keep up with your needs. This can make you feel sluggish, tired, and unmotivated, leading to sadness and hopelessness. If you're feeling depressed, talking to a physician or therapist is important. When the thyroid gland is underactive in hypothyroidism, it can cause changes in the voice. Number 15, hoarse voice and deeper voice. The vocal cords can become swollen and inflamed, leading to a hoarse and deeper voice. Though it's more commonly reported in women, it affects both genders. Interestingly, some famous singers are known for their deep husky voices, and it's been speculated that hypothyroidism may have played a role in their unique vocal qualities. For example, the singer Rod Stewart has spoken openly about his experience with hypothyroidism and how it has affected his voice. If you notice changes in your voice, particularly if it becomes hoarse or deeper than usual, it's worth bringing up with your doctor. Do you know what's not fun? Running to the bathroom all the time. And unfortunately, if you have hypothyroidism, that might be a problem you must deal with. Number 16 is bowel problems. Bowel problems such as constipation are a common symptom of hypothyroidism. Thyroid hormones regulate the digestive system, including the muscles that move food through the intestines. Low levels of thyroid hormone slow down digestive function, leading to constipation. One study found that up to 50% of people with hypothyroidism experience constipation. So, if you're experiencing constipation, you must talk with your doctor to determine the underlying cause and develop a treatment plan. Thyroid disorders can cause various symptoms affecting your body, mood, and overall health. However, it's important to talk to your doctor if you experience any symptoms of thyroid disorders, as they can be easily treated with medication and lifestyle changes. With the proper treatment, you can manage your thyroid disorder and live a happy, healthy life. Thank you for being so patient up to this point. It is greatly appreciated. Subscribe and enable alerts to avoid missing out on future videos from us and more. Check out this video to learn more about how to care for your body. And we'll see you in the following video.